Thanks, everyone, for joining us today from your homes and offices. I'm so happy to be here with Pam Smith, our VP of Account Management based out of our New York office. And Pam is going to be providing her unique insights from what she's hearing from our clients out in the field with respect to all of these developments. So let's go ahead and get started with our agenda for today. We're going to be talking about the big picture of things first. We'll give a timeline of sort of the big picture developments that have happened that impact health insurance and workplace policies. And then we're going to really focus on some of the major impacts of the Delta variant on health insurance and workplace policies, including a discussion of the big announcement from last week from President Biden about the federal vaccine mandate that will be going into effect soon. And then we'll talk about vaccine incentives and surcharges, under relevant laws, the ADA, HIPAA, ACA, and other implications. And then, of course, we'll talk about, and that's going to be a big part of what we're going to be focusing in on, because I think there's still so many questions about, what you can and can't do under those laws, and especially in light of the new news from last week. And then we'll focus on the new surprise billing and transparency developments, and then talk about some of the big things that we're seeing emerge from President Biden's healthcare policy and how we see the impact on health insurance and workplace policy. So then finally, we'll wrap up with some key takeaways and things that you can, discuss with your HR benefits and HR and benefits teams. So first of all, let's start with this timeline of major developments. Really the last few months has been incredibly eventful from a regulatory compliance perspective. So here are the big developments that we've been watching closely, all put together in this timeline. And we're going to go quickly since we'll be talking in a lot more detail about many of these things later on. So one of the big things that happened, of course, on May 28th was that the EOC issued updated guidance on vaccine mandates and incentives. And the big news there, of course, was that it allowed for employers to mandate vaccination or provide incentives in the workplace. And we'll be focusing more on that a little bit later. And then on June 17th, in California v. Texas, the U.S. Supreme Court, by a vote of 7-2, denied a constitutional challenge to the ACA, alleging that the entire ACA had to be deemed unconstitutional since it was not severable from the individual mandate, which, if you can remember, had its penalty reduced to zero by the tax reform law, the TICJA. The court concluded that the plaintiffs did not have standing to challenge the constitutionality of the penaltyless individual mandate of the ACA. Now after the individual mandate went to a zero penalty, and this decision is the Supreme Court's third rejection of a broad global challenge to the ACA in less than a decade. So that was a major thing that happened back in June. And then on July 1st, the agencies issued an interim final regulation, or IFR, implementing the No Surprises Act. And we'll talk more about those new rules a little bit later. And on July 9th, President Biden issued an executive order on U.S. competition, seeking to lower prescription and healthcare costs, and we'll talk about that a little bit later as well. July 19th, the agencies delayed the requirement to cover HIV PrEP without cost sharing all the way until September 17th of 2021. So you have a few more days now to make sure your plans are covering that as a preventive service at no out-of-pocket cost. July 19th, the agencies delayed, I'm sorry, I just said that one. Let me switch to the next slide. July 23rd, the IRS proposed substantial changes to ACA information reporting requirements in a proposed rule that would lower the threshold for mandatory electronic filing of Forms 1094C and 1095C from a threshold of 250 or more returns to 100, and would require employers to aggregate the number of different returns that they file when determining whether the return threshold has been met. So in other words, you would include your W-2 numbers as well. And these rules are expected to go into effect in 2022. And given the proposed 2022 effective date, if you're an applicable large employer under the ACA, you should really be monitoring this development carefully. And if you haven't been doing so, for many employers, they'll now have to prepare for mandatory electronic filing as soon as March 31st of 2022. And then on August 6th, there was a very big news announcement when United Airlines announced that it will require employees to be vaccinated. We'll talk more about that later. And then August 11th, the DOL settled a major lawsuit against United Healthcare in Oxford under the mental health parity laws, and we'll talk more about that in a little bit as well. August 16th, the agencies issued guidance signaling that they will soon be issuing a change to the ACA contraceptive coverage mandate rules. We'll also talk about that later. August 18th, the Biden administration recommends booster shots beginning in September. We'll talk about that later as well. And then August 20th, the agencies delayed enforcement of the healthcare transparency rules by 6 months or longer. We'll talk more about that a little bit later as well. August 23rd, the FDA granted full approval of Pfizer COVID-19 vaccine. We'll talk about that a little bit later as well. August 25th, Delta Airlines imposed a premium surcharge on unvaccinated employees. We'll definitely be talking about that later. And then September 7th, the American Academy of Pediatrics released a report showing children represent more than 1 in 4 of the new weekly national COVID cases. And then quite recently, September 9th, President Biden announced a federal vaccine mandate on private employers with 100 or more employees, as well as federal contractors and federal employees. We'll be talking about that in more detail as well. And so I'm sure you're all tired of hearing me talking, so I'm now going to, Pam, if you can maybe cover these last 2 items, the reminders of upcoming deadlines, that'd be great.
Sure, Dan. As a reminder, plan administrators must provide the new notice to AEIs who will lose the ARPA COBRA subsidy no more than 45 days and no less than 15 days before the date that the COBRA subsidy ends for each AEI individually. Although the subsidy will end although the subsidy will end earlier than September 30th, 2021, for some individuals, plan administrators likely will need to send a large number of expiration notices to AEIs whose subsidy ends through the entire subsidy period, that is through September 30th of 2021. And accordingly, the larger bulk of subsidy expiration notices will need to go out by no later than 9/15, which is tomorrow. However, before you send notices, please check with your COBRA vendor or your CSG account manager to find out if your COBRA vendor is providing these notices for you, as many are. And then the other reminder is Medicare Part D notices. So plan sponsors are required to provide the notice of creditable or non-creditable coverage to their employees and their employees' covered dependents who are Medicare eligible prior to October 15th of each year. And don't forget also to make sure that you did report your pharmacy coverage to the CMS website within 60 days from your renewal. So let's go ahead and get started with a discussion of probably the biggest thing that's impacted your decisions from a regulatory standpoint in the past few months, and that's the Delta variant.
Great. Thanks, Pam. That's definitely true. I mean, there's so much that's happened with the Delta variant that impacts health insurance and workplace policies. Among the other things we've seen this summer, right, we've seen these very morbid ICU capacity maps, mandatory vax policies, mask mandate bans, and then court decisions banning the mask mandate bans and more, right? So much has happened. So let's do some quick background on why it's had such a big impact without diving too deep into all the CDC data here. But, the Delta variant really began to impact the U.S. in June of this year. And really by the end of July, Delta was the cause of more than 80% of new U.S. COVID-19 cases, according to CDC estimates. And really, I mean, thinking big picture here, really, why is the Delta variant, right, so different? And just to summarize briefly, right, without going into all the science, there's really 2 big differences that we're seeing, right? It's more transmissible, right, and it's harder on younger people than the original variant. I mean, there's a lot of data that shows the sort of increase in pediatric hospital admissions. This is a chart showing from the week ending August 27th, the increase. And also, you can see really we've seen a lot of this the impact, especially with regard to children and teens, really kind of coming out of the southeastern United States. As you can see, those red areas on that map are the areas with over 100 child hospitalization cases per 1,000 individuals in that week. So, Pam, do you want to speak to how this has impacted the workplace, particularly with regard to the children issue?
Yeah, absolutely. So the impact to children has played a huge role in revising many of our clients' original back to work plans. While many thought they would be opening offices back up in September, many clients have postponed openings because of the Delta variant and requiring all vaccinated and non-vaccinated employees to wear masks on site at all times to protect colleagues who have small children from contracting the disease, which could infect their children.
That's right. I mean, I think it really kind of changed the game and really, changed mask mandate policies quite a bit. Now, with regard to insurers, one of the other big things that we saw with the Delta variant was that insurers stopped, waiving out-of-pocket costs for COVID-19 treatment, right? Just really as the Delta variant began to really devastate the U.S. this summer, particularly in the South and Southeast. And this, of course, led to massive claims costs and health plans. And just some quick background here from a regulatory perspective, while federal law requires all private insurance plans to cover the entire out-of-pocket costs associated with approved COVID-19 testing, right? So long as the test is deemed medically appropriate, used for diagnostic purposes, as well as the entire out-of-pocket cost of vaccination. There's no federal mandate out there, federal law that covers the cost of, that requires the insurers to cover the cost of treatment for COVID-19. A KFF, Kaiser Family Foundation report released on August 19th indicated that beginning in June and July, as vaccines became widely more available, most large insurance carriers stopped voluntarily waiving these treatment costs. The report found that 72% of the two largest insurers in each state and D.C. were no longer waiving these costs, and another 10% of plans were phasing out the waivers by the end of October. And really, the numbers are really just kind of astronomical when you look at it, and really in the billions. I think in June and July the numbers were, the KFF had numbers of about around a little over $2 billion approximately of claims costs from unvaccinated individuals, and that more than doubled in August. So these claims cost numbers are just absolutely huge.
So Dan, did you know that actually some insurers last year spent as much on COVID-19 testing as they did on hospitalizations? And while they thought the testing costs would come down as more people got vaccinated and less tests were needed, the Delta variant changed that, and testing really increased after a very short lull.
Yeah, I mean, that's really crazy, but it does make sense, right? In light of everything we've been seeing sort of change as a result of this variant. And on that point, right, we saw one other thing kind of happen here, which is that, the Biden administration recommended a booster round based on what they were saying out of Israel, which was that it looked like the vaccines were only kind of lasting for about 6 to 8 months. The goal there was to make sure that people would be protected. There were a number of breakthrough cases, and this was supposed to begin in September for all adults. There is some news reports saying it may be a little bit delayed, but that's going to be a very big development. And then, of course, another big development that happened that we should also address is the FDA granted full approval of the Pfizer vaccine. And the reason why that's important is because, it is relevant to workplace policies, because one of the roadblocks for many organizations to implement a mandatory or incentive-based vaccination policy was the fact that the vaccines were only approved on an emergency use authorization basis only. And so there was concern that employees would, object to any kind of mandatory workplace requirement on that basis. And then that changed on August 23rd when the FDA approved the Pfizer vaccine under a full approval. Then, of course, I think we definitely have to mention the fact, Delta Airlines and United Airlines announced vaccination policies. First, United Airlines announced on August 6th that they will mandate vaccinations beginning in October. And then at the end of August, Delta Airlines announced it will impose a $200 a month premium surcharge on unvaccinated employees. And just for some early results there, I saw that on CNN, approximately 50% of the unvaccinated workers at United have already become vaccinated. This was just last week. And then also with regard to the Delta premium surcharge, they were showing that approximately 20% of the unvaccinated employees had been vaccinated. So obviously a big change there based on those types of policies. We should also mention that there has been a very big impact on state and local regulation, and we should note that the Delta variant had a big impact on states. Some states like Texas and Florida, took a more libertarian approach, you might say, and even went as far as to ban mask mandates, with Such bans later overturned by courts. Other jurisdictions responded with stricter policies, such as New York City, with its key to New York City policy requiring proof of vaccination by employees working in certain industries like indoor restaurants, gyms, theaters. And then additionally, some states and localities delayed or waived compliance requirements, even benefits compliance requirements like San Francisco, which had initially delayed applicable reporting requirements under the San Francisco Healthcare Security Ordinance's reporting requirements from April 30th of this year until October 31st, and then more recently announced that it has completely waived the reporting requirement for the 2020 calendar year. So let's talk about the big news, right? The big news is that was in the news last week, and kind of what's happening as a result of that. So on September 9th, President Biden announced his new the Biden administration's new path out of the pandemic action plan, which describes the 6-pronged strategy that they have to fight the pandemic. It relies heavily on vaccine mandates and testing. Specifically, includes a mandatory vaccination requirement for federal employees and federal contractors, and a mandatory vaccination requirement or weekly testing option for private employers with 100 or more employees. And so let's talk about that first part, right? The requirement on private employers with 100 or more employees. So the White House directed the Occupational Safety and Health Administration, or OSHA, to develop and issue an emergency temporary standard, or ETS, right? Mandating that employers with 100 or more employees require employees to be fully vaccinated or submit to weekly testing. And under the anticipated ETS, employers also must provide paid time off to employees for receipt of the vaccine or recovery from post-vaccination symptoms. Employers violating the rule could face fines of up to $13,653 per violation, which could possibly increase to as much as $136,532 per violation for repeat offenders. It's unclear exactly when this rule will be published, but several reports are indicating it could be released very soon, even later this month. And the rule will be effective, very soon is the goal. At least we don't know the exact date, but some have said, some are saying 75 days from now, some are saying around that time. So one big question, of course, is that that's still outstanding. Of course, is the specifics around the testing as an alternative to vaccination requirement, sometimes referred to as the test out rule, and whether employers or employees will be the ones required to pay for the weekly testing, including compensation for the time that it takes to be tested, right? That part was not really discussed anywhere in the action plan. You actually see the action plan for yourself down there. You can click that link in that second bullet. Some states like California and Virginia, currently, right, in some states like California and Virginia, employers are required to pay for workplace COVID-19 testing. And so, other states, they're not. So it's something that we're really hoping to get more clarity on. It should also be noted that the White House did state in part 4 of its action plan that it was working with relevant industry officials to make at-home tests more affordable. And that's, I think, a big question here, right, is will there be enough tests for everybody to for every employer that has 100 more employees to do this? And there's other details of the OSHA's anticipated ETS rule that are still, not yet clear. So, for example, the White House has not issued any kind of guidance at all on whether the 100 or more requirement for the employee count, 100 more employees, whether that's going to be company-wide, such as, taking the entire control group into account, or if it's going to be based on subdivisions, such as, individual EINs or by geographic location. But given the announced anticipated coverage of more than 80 million workers, employers should be prepared for broad coverage, probably based on company-wide numbers or control group, incorporating all the entities that are in the control group. Another open legal question that we're seeing is whether the ETS will preempt state and local laws relevant to vaccination status, including laws that prohibit discrimination on the basis of vaccination status. So a lot of questions still, and employers are definitely going to still have to wait and see what's in that ETS really before determining the rule's full effect. And so, we'll be obviously keeping you updated on our Compliance Resource Center page, as well as alerts once we get the more specifics of the rule. And then, of course, another big part of this, right, of all of these sort of initiatives that were announced on September 9th, from the White House that are applicable to employers. The initiative with the most immediate impact is the executive order that mandates federal contractors and subcontractors to require their employees to be fully vaccinated against COVID-19. And this executive order only applies to employers working pursuant to contracts issued on or after, or which extend into October 15th. And the executive order goes beyond the prior orders by including contractors working on or in connection with a federal contract at any contractor facility, not just contractor employees working on site at a federal facility. So that's kind of taking it to another level. Also, the executive order appears to eliminate the test out option for these federal contractor employees. And so it's something we'll be watching as well for a lot of our government contractor clients. The White House also stated that the Centers for Medicare and Medicaid Services will require that certain healthcare workers at facilities receiving Medicare or Medicaid funds must be fully vaccinated. So a lot of rules here and a lot to come, and we'll be just watching this extremely closely. And really in terms of compliance costs and administrative hassles, covered federal contractors, healthcare providers, and employers who have not yet implemented any kind of vaccine mandates really are going to probably face the largest burden of trying to kind of get up to speed as to how you do this. They're going to have to develop policies and procedures, figure out how employees are going to be submitting proof of vaccination and requests for exemptions and accommodations. So a lot of things to do there. Private employers can also still consider avoiding the administrative burden of large-scale weekly testing required by the ETS by rolling out a more strict vaccine mandate without the test-out option. There's nothing, at least in the guidance released so far, that would prohibit that, so long, obviously, as it's allowed under applicable state law. So that's another option that employers are also considering as they go forward. And of course, as a result of this development, employers that have already issued vaccine mandates, as well as those that were planning on issuing them, are now re-examining their programs to ensure compliance with the new standards. And as many employers have already implemented them earlier this year. So, of course, all of these pandemic-related developments in the news, including those before the president's big announcement last week, had and will have a huge impact on employers' health insurance plans and workplace policies in the weeks and months ahead. So, Pam, let's start with the health insurance impact, right? Obviously, the claims cost impact is huge, particularly for a lot of our clients in the South and Southeast. What kinds of strategies have you seen employers implement, and what are you expecting to change sort of as a result of last week's big announcement?
Well, Dan, the impact has taken many forms with regard to benefit plans. I'm seeing employers look to really understand what their employees desire in benefit plans for three main reasons. The largest being the tight job market and employers' desire to attract and retain employees. The secondary reason is that the work landscape has changed and benefit plans are changing with it. And then the third is cost. So employers want to know what they can eliminate from their plans that's no longer valued and repurpose the money for programs that their employees are really looking for. From a cost perspective, it's indisputable that that 2020 was a lower claims year for insurers, but 2021 proved to be a much more costly. Carriers are still, for the most part, adding COVID loads to renewals, even when they're not using the deferred care months to actually calculate the renewal. And it's really more important than ever to understand all components of a client's renewal to effectively negotiate to the best outcome. I think one question employers will have with regard to the new Biden legislation is how will mandatory vaccination impact costs to the medical plan? While vaccination administration costs did increase from $25 per shot to $45 per shot, the cost to health plans is minimal compared to what it could be because the government is footing the bill for the serum still at this point. So if that changes, this will be a much larger factor. For testing, up to now, the workplace testings have really been the responsibility of the employer. The mandatory testing policies could be extremely expensive, and really the question is, to your former comment, the question is to who? Where is that cost gonna lie? From a workplace policy impact, HR teams are busier than ever drafting vaccination policies, mask policies, incentive policies, return to office policies, work from home policies. The rules are changing frequently, as illustrated by Biden's September 9th announcement, and employers need to stay informed of how to navigate the changes to these laws. So new rules may limit flexibilities that employers intended to give employees, and could make their original policies too costly to implement. So employers are reviewing. Employers are also reviewing accommodations for employees who now live in other states, and accommodations for employees who cannot be vaccinated. And employers, recognize that the at-home work environments are impacting the culture of their organizations and diluting the effectiveness of their mentoring programs. So revamping policies to support the organization and its mission as we continue to face pandemic challenges is critical to our clients. To help, and so what we've been seeing is that to help implement and enforce the policies they're making, the policies that they are making, many employers are considering vendors that can support them. We're looking at leave absence programs with ADA accommodation support. For our clients, we're looking at enhancing EAPs to support employees and managers, and support training classes and connecting with remote employees. And while the policies vary greatly due to corporate culture and productivity needs and industry, the goal is really universal, and that's keeping employees safe, productive, and restoring an environment that supports physical and mental health in the workplace. And, of course, obviously complying with federal, state, and local legislation, and then understanding their cost for allowing accommodations and making these changes to their policies.
Thanks, Pam. That's really helpful. I think there's so many of those things are so important, and I know you've been working very closely with our clients, supporting them in those efforts. So that's really terrific. And of course, we often get the question, right? What's next, right? Given that we're seeing these trends from across the country, and just looking at the data, at least in my view, even though the new federal vaccine mandate announcement last week is certainly going to reduce the spread and push this thing in the right direction, I think we're still likely to see the Delta variant prolong these pandemic-related restrictions in the workplace, and we're likely to see more school closings, child hospitalizations, and things like that as we get into flu season, where the Delta variant will likely spread more quickly, particularly as schools open up. So even with mask mandates, we're still seeing many schools with poor ventilation, crowded lunchrooms, and overall just a lack of understanding of the transmissibility of this variant, which of course, may lead to more and more employers delaying their return to work dates, and just a prolonged period of disruption. I hate to be the pessimist, but unfortunately that's the way it still looks right now.
Agreed, Dan. I think, unfortunately, we still have a long way to go, and it's definitely hit employers very hard in many ways.
Definitely. So while we're talking about how the big hit here, right, on employers, right, we should talk about, the move of so many employers to look at vaccine incentives and surcharge rules. And that's really going to be the central focus for today. Of course, we talk about the big costs that, what's really driving this already, right? So we don't need to kind of go through all that. But from a compliance regulatory standpoint, right, we had new guidance issued by the EOC on May 28th saying it's okay to require or mandate vaccination in the workplace. But the guidance was notably silent on whether such incentives could be offered through a group health plan or wellness plan. And unfortunately, EEOC rules that are on that topic are still under review by the Biden administration, meaning that there's still considerable regulatory uncertainty about putting incentives and surcharges through a plan, and if so, how much can they be, right? Additionally, in this tough labor market for employers, where employers don't want to impose a vaccine mandate that results in firings and terminations, at least prior to last week's announcement, that was kind of the concern, even more so, right, before everyone had to do it, right? In light of that, employers were at least very interested in imposing a premium differential between vaccinated and unvaccinated covered participants, right? And imposing such a premium differential is, of course, doable, but it likely creates a group health plan wellness program, which implicates both HIPAA, the ADA, GINA, and other rules. So, when you look at all the rules that could go into imposing a vaccine incentive or surcharge through a group health plan or wellness plan, the great irony of it all is that given all of the regulatory uncertainty surrounding putting a vaccine incentive through a health plan or wellness plan, it's actually much easier just to fire someone for not complying with a vaccine mandate than it is to actually go through all of these compliance hurdles and regulatory uncertainties. And so many employers and plan sponsors just often start going down that road once they realize how many hurdles they give up. So let's talk about these rules in more detail because we've had so many of our clients ask us questions about these, and obviously there's so much that we could talk about here. So I'll try to kind of go through it quickly, but really let's start with what you could do outside of the plan, right? Because there's a lot more clarity there. There's workplace guidance that the EEOC issued about what you can and cannot do, in the workplace, right? Not talking about through a group health plan, just sort of outside the plan. And there it's pretty clear that you can, if employees voluntarily inform their employer that they received a vaccination through an unaffiliated third party like the federal government or at CVS, right? You can offer them an incentives. You probably should still provide some kind of reasonable accommodations and an alternative way for those who can't get vaccinated to get that incentive. And then if the vaccine is offered through the employer or an agent of the employer, like if the employer is doing the vaccination on site, the question then is, can an incentive be offered outside the plan? There, the answer is yes, but the EEOC said that the incentive cannot be so substantial as to be coercive. The employer still must offer reasonable accommodations for individuals with disabilities and sincerely held religious beliefs. And the employer cannot ask questions that would elicit information about genetic information, including family medical history. In our view, we also think a reasonable alternative standard or reasonable alternative way to get the reward should be available. If the vaccine is offered through the employer or its agent, can an incentive be offered for information about the vaccination status of family members? Unfortunately, no. That would be prohibited under GINA, but you can do it under that first situation. So in other words, if it's not through the employer or its agent, then you can get that provide an incentive for that information. So let's talk about the central focus of kind of what we do as benefits consultants, right? Can you offer a vaccine incentive or surcharge through your group health plan, right? And just to kind of give some background here, the short answer, of course, is yes. There's nothing that expressly prohibits it, right? But there's a lot of regulatory uncertainties and a lot of hoops to jump through. So from a regulatory standpoint, so let's kind of give a little bit of background here. Prior to being under review by the Biden administration, there were EEOC wellness incentive rules under the ADA and GINA that would have likely applied here. They had a de minimis standard. It was not clear what that amount would of the incentive could be. That it was just they just said that $50 per month or a total of $600 a year was more than de minimis, but they didn't give us an exact amount. And then they said there was an exception for health contingent wellness plans offered through a group health plan. If the wellness program was for a contingent activity only program, it was okay. But under those rules, there's also even other additional uncertainties. Those are the HIPAA non-discrimination rules. Here you see in that second box. We'll talk more in detail about those later, but obviously there's some very high penalty excise taxes that can be imposed for not complying with those. Then, of course, there's another big part of this, which are the ACA employer shared responsibility rules, which, the way that under those rules, the amount of a premium surcharge can render your plan unaffordable. And the reason for that is because any non-tobacco wellness incentive will be treated as not earned when you're determining affordability on your lowest tier plan. So let's just say, for example, your lowest tier cost of your employee-only tier plan is, let's say, $300 a month for that employee. Then you'd have to, and your premium surcharge for not getting vaccinated is $200 a month, right? Then you're looking at a $500 a month. Everyone across the board will have a $500 a month employee cost, which could be unaffordable, right, for some of your employees. So it's something to take into consideration under those ACA employer shared responsibility rules. And then, of course, for these, you have to offer reasonable, for doing this, you have to do, for offering an incentive or surcharge, you have to provide some kind of reasonable accommodation or reasonable alternative standard. If that's not done correctly, that can result in costly litigation, even if the employer, even if the employer prevails in the lawsuit. So there's a lot of considerations here. But one of the big areas where there's a lot of regulatory uncertainty is the HIPAA non-discrimination rules. And most commentators and ERISA attorneys like myself out there are of the view that if you are putting a premium surcharge or some other kind of incentive through the group health plan or wellness plan, that this would be considered to be a health contingent, activity-based wellness plan, although there is some disagreement out there. Some would think it's outcome-based. But I think the consensus view is that this would be considered a health contingent, activity-based plan under the HIPAA non-discrimination rules, which would mean that the amount of the incentive or reward cannot exceed 30% of the total cost of the applicable tier of coverage. There must be an opportunity for the employee to qualify for the reward at least once a year. The reward has to be available to all similarly situated individuals. And then, of course, there has to be a notice provided that a reasonable alternative standard will be provided, and the plan must be reasonably designed to promote health or prevent disease and cannot be a subterfuge for discrimination. So this seems like a lot of rules. There's actually even more rules if it's an outcome-based plan. We're not going to go through all those today because I think the area where there's the most uncertainty really is as to what you can or cannot do that is a reasonable alternative standard in that second to last bullet and the final bullet about what's a plan that's reasonably designed to promote health. And unfortunately, because these rules were issued before the COVID pandemic, right, we don't know the answers to those questions. So there's a lot of uncertainties, right? We talked about, is the plan activity-based or outcome-based? That's an uncertainty. But also, right, what if a reasonable alternative differs, right, based on the type of program and where you're located and all kinds of other questions that we don't know the answers to. And, what is a reasonable alternative standard, and will the plan be reasonably designed to promote health and wellness? It's unclear. Is it requiring masks and social distancing? Could that be an alternative standard that's reasonable? Well, maybe not if like, let's say your state or locality is requiring that even for vaccinated people, right? Is a PCR test as opposed to a rapid test going to be considered reasonable? And these are the questions that we still don't really understand yet, just because these rules were issued before the pandemic, and it's kind of unclear how to put it through this kind of paradigm. In addition to those rules, there's other compliance issues, including the fact that a premium surcharge could have a negative impact on the Fair Labor Standards Act and state wage and hour laws that require you to provide at least a certain amount as far as a minimum wage. So obviously if the surcharge is too high, you could be paying someone under the minimum wage. If you're implementing a premium surcharge mid-year, then you need to think about whether that is going to be a significant cost increase that would be impacting Section 125 regulations that would require a permitted mid-year election for that. So a lot of different things to think about. Really, we could probably talk all day and for another hour about all these questions that we're getting. But that just kind of just shows you all of the regulatory uncertainties that there are. And so again, we're not saying you can't do it, right? We're here to help you if that's what you want to do. But there are a lot of hoops to jump through, and there's a lot of uncertainties out there. So it's really good to be aware of all the rules. So Pam, do you want to talk a little bit about some of the questions we're getting kind of from clients and kind of what you're seeing out there and what some of the big questions are?
Yeah, absolutely. So our top two client questions with regard to vaccine incentives and surcharges are, number one, can I use my unused wellness budget funds to fund my vaccine-based incentives? And then number two, can I charge my unvaccinated employees more for their healthcare coverage? So let's take the first one. Due to uncertainties in ADA, GINA, HIPAA, really the best practice would be to use the wellness dollars that you have left over to fund a different qualified organizational initiative, and then run the vaccine incentive program outside of the wellness plan, and you avoid many of the complexities that Dan was talking about. The second question about charging unvaccinated employees more for healthcare, while it makes sense based on the increased risk of cost to the plan for unvaccinated employees, the rules are still unclear, as we just discussed. However, what is clear is that the complexities associated with the policy, are certainly there. And before offering, it's imperative to consider HIPAA and ADA discrimination rules, ACA plan affordability thresholds, and offering a reasonable accommodation.
Great, thanks, Pam. Yeah, great. And I think we obviously don't have all day to talk about this other topic, surprise billing and transparency developments. So I'm going to go ahead and get us started and try to give everyone a quick background on all the major recently enacted surprise billing and transparency rules, if that's even possible. I'm going to try. Then we're going to kind of go from there to talk about some of the more recent developments that have happened with these transparency rules. And then Pam can kind of go in a little bit more focus in on what employers and plan sponsors should be thinking about, some of their questions she's seeing. But really, the best way to kind of look at this from a kind of a big, 500-foot level or, bird's eye view is that there's three main sets of transparency rules that are out there. And really, these are really what you might say are kind of driving the storm of transparency regulation. The first one we have is, back in the fall of 2020, the government agencies issued a major regulation called the Transparency and Coverage Rule. And then Congress worked really hard on legislation to prevent surprise medical bills and to improve transparency in healthcare in a law called the No Surprises Act, which was then later incorporated into the Consolidated Appropriations Act of 2021, or CAA. So that's that third rule there, which includes additional. So the CAA has, right on top of the No Surprises Act, the CAA has additional initiatives to improve transparency, including transparency rules relevant to, mental health parity, broker consultant transparency, and other things. So all kinds of different transparency rules out there. To discuss all of these in a lot of detail would take an extremely long time. But to summarize generally, right, all of these are designed to make participants in health plans better consumers of healthcare, to increase the transparency of their healthcare-related costs for medical services and items. They require publication to the public or disclosure of certain information to government agencies, and really to significantly reduce the high incidence of surprise medical bills, and all of that is kind of a big part of all of this. And most of these rules, at least initially, they were planning to go into effect for plan years beginning on or after January 1 of 2022. While there's some that are still currently in effect right now. But most of these rules primarily are going to be imposing significant administrative and disclosure-related burdens on sponsors of self-insured health plans. And so for sponsors of those plans, they're the ones who really need to work very closely with their TPA and carrier partners to make sure that their plans are in compliance, because they could be on the hook for some of the liabilities here. And just to kind of briefly kind of go into what's happened in recently in July, we saw an interim final regulation, or IFR, on the surprise billing rules that was really supposed to be the first of three major regulations that implement these surprise billing rules in the No Surprises Act. This big IFR, right, was issued on July 1st by the HHS, DOL, IRS, and the Office of Personnel Management, and it's really designed, it's really designed to implement a lot of these rules in the NSA and prevent surprise medical bills, increase healthcare price transparency. But the big things, I guess, the big picture of what it does is that it bans surprise billing for emergency services. It bans high out-of-network cost sharing for emergency and certain non-emergency services. And then it bans out-of-network charges for ancillary care, like an anesthesiologist or assistant surgeon that's working at an in-network facility in all circumstances. And it bans other out-of-network charges without advance notice. And the IFR makes these rules effective for plan years beginning on or after January 1 of 2022. And applies them to both grandfathered and non-grandfathered plans. And that's one of the big things here, that some of these things were things that were in the ACA but did not apply to grandfathered plans, but this applies the rules to both grandfathered and non-grandfathered plans. And then additional regulations are expected to be coming to discuss other aspects of the No Surprises Act, including the Independent Dispute Resolution, or IDR, process. But to kind of summarize quickly here, a lot of time in these regulations is spent explaining the recognized amount and qualified payment amount, or QPA, which are essentially the ways that a group health plan can essentially charge for certain services and impose, determine what the cost is the quickest way to put it. And there's a lot of very technical details here about how the cost sharing is calculated under different circumstances and whether, and it will also, of course, depend on whether there's an applicable state law or an all-payer model agreement in that particular state. So there's a lot of very technical details we don't have time to go into today. But I think the most notable thing here on this IFR is that not all surprise medical bills will be banned, and participants may still come to your HR department or benefits department with concerns about surprise medical bills. For example, if patient consent to out-of-network charges is obtained by a non-participating provider prior to the patient receiving certain types of post-stabilization or non-emergency services, and all the other IFR's requirements are followed by the provider for that consent, then these rules would not apply. Additionally, if the IFR does not apply to bills for certain non-emergency items or services provided at facilities that are not included within the definition of a healthcare facility in the IFR. So there's a lot of circumstances here where someone could still get a surprise medical bill. So it's just important to understand that, and that these things can still happen. And of course, I think the second really biggest development here that happened with regard to the new rules is that the agency's delayed enforcement of several CAA and other transparency rules in new guidance that came out at the end of last month. And while the new guidance doesn't really change the law, it gives some clarifications about the law here and there. I think the most notable thing that it does is that it delays enforcement of several of these price transparency rules, including the new requirement to disclose what are called advanced EOBs, which was that requirement was delayed from the initial effective date of January 1, 2022, until such time as plans, insurers, and medical providers can really build out the infrastructure that's necessary to transmit those advanced EOBs, and until the agencies can issue applicable regulations and guidance on those disclosures. So that was a big change. Also, the price comparison tool, which was really designed to help consumers have a better understanding of the cost for certain services and medical items, was delayed from the initial effective date of plan years beginning on or after January 1, 2022 until plan years beginning on or after January 1 of 2023. And then there was a requirement to report certain drug cost information to federal regulators that was supposed to go into effect December 27th of 2021, and then that was delayed first initially until June 1 of 2022, and then the agencies will now delay enforcement until they can issue further guidance on that. And then there was also a requirement to disclose to the public health plan pricing information related to in-network and out-of-network rates and allowed costs, as well as certain prescription drug prices. That was delayed from the initial effective date of January 1, 2022 until July 1 of 2022. And for the prescription drug component of that, enforcement was delayed until the agencies can issue regulations on this requirement. So to summarize here, there's a lot of administrative work that is going to still be required of TPAs and carriers for sponsors of self-insured health plans prior to 1/1/2022. And some of this got delayed, fortunately. I think there were some costs already that were going to be going into effect, for the 1/1 renewals, but I think a lot of that has been delayed or pushed off. So Pam, maybe you can talk a little bit more in a little more detail about kind of what you're seeing out there, what kinds of discussions you're having with your clients and with their carriers and TPAs to really get them ready for this.
Sure. So there are certainly a number of very complicated rules that will need infrastructure built to accommodate. The carriers are making a big investment in time and dollars to comply, but it's going to take some time, and hence the announced delay in start dates. Fully insured plans will not have to worry about much of the reporting, as the carrier will be required to report mostly on their behalf. Self-funded employers should be working with their benefits brokers to determine carrier, PBM, TPA responsibility versus employer responsibility, and whether there will be increased costs or workload in the future. So a number of these things were postponed, as Dan talked about. But let's talk about some of the ones that are affecting us currently. So one of the earlier requirements is mental health parity reporting, which requires employers to provide a comprehensive analysis of any non-quantitative treatment limits if requested by the DOL. So it's only needed to be furnished upon request. Fully insured groups can get this from their carriers. Self-funded groups need to check with their carriers or TPA to see what they will be, what they can provide, whose responsibility it is, and if it meets the requirement. So that's something that we would suggest. And then another requirement that will impact all of us in the short term is that plans will need to issue new ID cards to all participants to comply with the laws. So your carrier should inform you of this and the process or deadlines that they'll need, for their eligibility to have corrected ID cards created by 1/1/2022. And we can discuss more of the requirements, and I'm sure we will in a later webinar when we get more clarity on their rollouts. But one of the ones I'm personally looking forward to as a high deductible health participant is the enhanced pricing tools due to be released by 1/1/23.
Me too. I am also a high deductible health care participant, and I am also looking forward to that as well. So a lot of things that are changing there. Thanks for your perspective, Pam. I know we're going to be helping our clients through that. And even though there's been a delay, I think we really just need to make sure people are kind of beginning that process now, at least of understanding what's going to be required. Okay, so let's talk. Our final piece here, our final segment for today is about the emergence of Biden care, right? The fact that we're seeing really a new healthcare policy that is going to have an impact on your plan, on your workplace policies. And I think, one of the, there's so many indications of this. Obviously, the big announcement last week that we saw of how, President Biden will be, impacting things in the workplace. But there's really so many things. I think it really in many ways is trying to bring the ACA and other healthcare laws back to where they were under the Obama administration. And some recent examples here of some of the things that we're seeing are on July 9th, President Biden issued an executive order that will likely have a big impact on healthcare policy. And that reflected a lot of the initiatives he had when he was campaigning. Among the 72 different initiatives, right, in this executive order on U.S. competition, there were several that were designed to reduce prescription and healthcare costs. For example, it directs the FTC to ban price gouging agreements used by drug manufacturers. It encourages the agencies to issue rules to make it easier to import prescription drugs from Canada. It takes aim at consolidation in the hospital and health insurance industries, and really directs agencies to do more, to enforce, rules that will lower costs, including one of the rules I think that will have a more immediate impact is that it directs the agencies to allow over-the-counter sales of hearing aids. So that is something else to look out for. But really, just I think the big picture there is that one of the other big things is that they made it clear in that that enforcement of mental health parity laws and transparency laws will be a priority for this administration. And as an early example of that, we saw quite recently on August 11th, an example of that when two settlement agreements were filed on that day that provide that United Healthcare, United Behavioral Health, and Oxford Health Insurance will together have to pay more than $15.6 million to settle allegations that they have violated the Mental Health Parity and Addiction Equity Act. The settlement marks the clearest signal yet, in our view, of sort of the Biden administration's increased enforcement of the mental health parity laws that were really kind of overlooked in many ways by the prior administrations, or not taken to the same level of seriousness. And of course, that I think is a precursor of what's to come with regard to many of the transparency initiatives in the CAA, that they're going to be taking very seriously. And then finally, it seems clear that part of the new Biden care policy that we're seeing will be directed at reversing some of the Trump administration's changes to the ACA and some of their protections that they provided to religious organizations. And notably, on August 16th, the agencies overseeing enforcement of the ACA released FAQ guidance that advises that the agencies are considering changes to the broad exemptions to the ACA's contraceptive coverage requirements in light of recent litigation, and they're intending to issue rulemaking to amend those. And I think, that those rules have given really very broad exemptions on the basis of religious and moral objections to the ACA's contraceptive coverage mandate. So we'll see, I mean, what those say, but I think it's likely that they'll be bringing it back to closer to what it would look like under the Obama administration. And then also consistent with this development, President Biden has spoken out about his opposition to a recent Texas law, Senate Bill number 8, that bans abortion at 6 weeks. That's caused quite a bit of controversy since the Supreme Court refused to intervene to stop it from going into effect on September 1st. And so I think these types of things really kind of show us kind of where the Biden administration is going and, with regard to policy in the future. And of course, this brings us to the question of really, right, what's next when it comes to Biden care? Right. Well, in many respects, right, it's the old Obama ban that's come together. Right. He's bringing the ban back together. I think there's many areas where, things are really new and unique to this president. I think we're going to continue to see, stronger enforcement of mental health parity rules, pushes to reduce prescription costs, much in the same way Trump did, I think, to, try to get prescription costs lower, and new legislation that his administration is working on with Congress is likely to introduce several new initiatives to do things like reduce student loan debt and provide greater paid leave benefits. And so I think those are things that could really kind of impact benefits in the future here. So Pam, what do you think is kind of the next big thing to come out of the Biden administration when it comes to health insurance and workplace policies?
Wow, that's a great question, Dan. Without my crystal ball, I also think President Biden has shown commitment to restoring the provisions of Obamacare and strengthening its original intent because of his stated commitment to make affordable quality healthcare more accessible. I think we should look for lower affordability percentages, which actually were just announced, and more benefits that protect women's health. Again, like you had highlighted, a greater focus on mental health and substance abuse benefits. We've also seen many flexibilities to the law regarding to QLE extensions for plans, COBRA exceptions, elongated exchange open enrollments. It's clear he wants more Americans to have coverage. One of the things he's talking about for the next bill is federal PFL. This could standardize benefits for multi-state employers and create some consistency amongst administration, which I think would be welcomed by many.
Definitely. I think those are definitely a lot of the things that are high up on the agenda for the Biden administration. We're definitely going to be seeing more and more things like that. So I agree with you 100%. And, I think one thing before we conclude here today, I just really want you also to be we had some key takeaways here that we wanted to kind of talk about. And Pam, you want to kind of get us started about from your take? So
I think the biggest takeaway is how much there is to take away. So, more than ever, it's important to read the CSG alerts and discuss your company policies with your CSG account managers, your legal counsel, and of course, Dan and our compliance team for next steps and directions. We're here to help.
Definitely. And, unfortunately, I think one of the big takeaways, right, is that it's just really important to stay on top of the rapidly evolving regulatory environment, right? It doesn't look like the pandemic is going to be ending anytime soon. So we'll be seeing probably more and more changes to the rules, in the days and weeks to come. And despite all the recent delays, I think with regard to the transparency rules, I think it's still important for employers and plan sponsors, particularly of self-insured health plans, to really start looking now at those rules and understanding what they need to do and what they need to negotiate with their TPA partners. And I think finally, just about kind of the big picture, right, before implementing something that another company is doing, or maybe Delta Airlines is doing, or something that you see in the news. I think it's really kind of good to look at kind of what's out there, right? What are all the different rules that are out there that could come into play, as well as sort of cost implications and potential fines and penalties and litigation costs, as well as morale and especially in this job market, retention and employee attraction considerations. So there's just so much to think about. It's important just not to act rashly and to take time to get it done right. So that's it for today. I just want to finally, on behalf of all of us at Corporate Synergies, thank you so much for joining us today. And we do have some great links here. The Compliance Resource Center is that top link, which is where we kind of post all of our blogs and news developments that on things kind of they're more breaking as they happen. And you can also access our alerts there. Also, we'd encourage you to join the Health and Welfare Compliance Forum, or HAWK, and to check out our upcoming events at our events page. So thanks again, and thanks for joining us today.